Hi doctor friends, welcome to my YouTube channel PG Doctors INDRANJU. Today's we are discussing about the Pharmacology one-liner part 2 that are previously asked in NEET PG, AIIMS PG, DNV, FMGE and all other medical PG exams. This is just for revision. I will describe behalf of you the topic which are most important. So watch this video till last and subscribe, share, like my video and don't forget to press the bell icon for latest upcoming updates. Let us start. The opioid receptor responsible for dysphoric effect, kappa. The opioid receptor kappa is mainly for dysphoric effect and psychotomimetic effect, while that mu receptor is for euphoric effect. The dysphoric effect. What is the dysphoric effect? Dysphoric effect, it is a state of feeling unwell, unhappy, emotionless, mental discomfort, suffering from restlessness, malaise, depression or anxiety is known as dysphoria. The dysphoria is for kappa receptor, dysphoric effect for kappa receptor, and euphoric effect is mu receptor. The opioid receptor, they are agonist and the antagonist. If you look opioid drug, then it is agonist and antagonist. Agonist is butorphanol, nalbuphine, nalorphine, pentazocine. While that drug, the antagonist opioid drug is naltrexone, naloxone and buprenorphine. Here the naltrexone is a strong antagonist. Next is ritonavir, inhibit amiodarone, cisapride and midazolam. Ritonavir is a protease inhibitor. Next is orphan drug, or drug for treating rare disease. The orphan drug is a drug that treat the rare disease or medical condition like overload of iron overload in the thalassemia by the diferipyrome. Next is for the poisoning like paracetamol and acetylcysteine are used. The Orphan Drug Act is started in the 1983. This act is to stimulate research development to treat the rare disease or medical condition. This is the orphan drug. The trial performed to determine the maximum tolerated dose of a drug is phase 1. If you look the clinical trial, it is divided into the 0, 1, 2, 3, 4. Start with phase 0. It is also known as the microdosing study and used in healthy volunteer in a small number to know pharmacokinetics, and this could avoid the costly phase 1 study for the candidate drug with unsuitable pharmacokinetics. And phase 0, you have to remember, the used for a small number and for healthy volunteer. Next is the phase 1. Phase 1 clinical trial. is for the human pharmacology and safety. This is asking question for the pharmacology and the safety, and this is also used in healthy volunteer, and it is open label, no blinding required. No blinding required to know maximum tolerable dose and safety and tolerability. Here you have to remember this all underlined point: human pharmacology and safety, healthy volunteer, no blinding, and to know maximum tolerable dose and safety and tolerability. Next is the phase 2 clinical trial. Here it is also called as the therapeutic exploratory. Patient is homogeneous and population, that means the 0 and first used in healthy volunteer, then after the patient. Here the patient is of homogeneous population, and here the start with the blinding, that means the single blinding and controlled to establish it is for started for the therapeutic efficacy and dose ranging and ceiling effect. This is the for phase 2 trial. The phase 3 trial to confirm therapeutic confirmatory trial third is used, and patient from the several centers, that means the heterogeneous population, and here the trial is randomized control trial, and here double blinding is used. In first no blinding, second single blinding, third double blinding to confirm the therapeutic efficacy, to establish the value of the drug in relation to existing therapy. It is the third trial. And fourth is for post marketing surveillance, and a large number of patients being treated by practicing by physician, and to know the rare and long term adverse effect is for the phase 4 trial. This is clinical trial for your revision purpose. The injection available for subcutaneous administration is the first terbutaline, insulin, morphine, goserelin. These are subcutaneous administration drug. Next is drug causing SLE-like syndrome is INH, hydralazine, sulfonamide, and also procainamide. These all are SLE-like syndrome. And also there is a trick for such is SHIP. S for sulfonamide, H for hydralazine, I for INH, and P for procainamide. Next is the one concern of the drug designing is to increase the number of interaction of the drug with the target protein. Next is the one of the many mechanisms of adverse events is its increased binding to secondary targets, usually protein. With respect to primary target, the secondary target, it should have a similar binding site. The vasopressin antagonist acts on the part of nephron is medullary collecting duct. Here the vasopressin receptor antagonist is of three types mainly. One is V1, V2 and V3. V1 is also known as V1A, while that of V3 is known as V1V and V2. So three types are recognized, which are arginine. This is also known as arginine vasopressin receptor antagonist. These are second are, that means V2 are found in renal medullary collecting duct, while that the V1A and V2 are peripherally placed, while that of V1A and V1B are centrally placed. If we ask about the V1 receptor, V2 receptor, V3 receptor antagonist, oxytocin receptor, all are homogeneous in nature, chemically homogeneous. The drug for vasopressin receptor antagonist, these are mixed. V1A and V2 are the conivaptan. These are conivaptan. While that of V1A selective vasopressin receptor antagonist, it is relcovaptan. While that V1B selective is nelivaptan, and V2 selective is tolvaptan, satavaptan, lixivaptan. A glaucoma patient is being given systemic beta blocker. What to be given? Here the note is not here. What to be given is levobunolol is given. In glaucoma, many drugs are used. I am mainly focused on the beta blocker. Beta blocker is used to decrease the aqueous secretion. These are divided into two groups, cardioselective and non-cardioselective. The cardioselective drugs are the betaxolol and levobetaxolol, and non-selective is the timolol and albunolol and cartiolol. Here the levobunolol is the longest acting. Next is the second generation antihistaminics are the cetirizine, loratadine, fexofenadine, terfenadine, desloratadine, astemizole. Here we have to remember the terfenadine, which are second generation antihistaminics, are the fastest acting second generation antihistaminics, while that of in the cetirizine, here the cetirizine, which are derived from the first generation antihistaminics, hydroxyzine, and astemizole are the slowest and the longest acting second generation antihistaminics. Next is the drug used in the treatment of the erectile dysfunction. Here in the erectile dysfunction, the prostaglandin E, vardenafil, alprostadil are used. Next is the ocular side effect of the heart therapy is the uveitis. First of all, what is the heart therapy? The heart therapy, HAART therapy, that means highly active antiretroviral therapy. These are also called as combination ART or CART. It is for control of HIV infection, especially viral replication load, and that includes the multiple antiretroviral drug and maintain immune system and also prevent the opportunistic infection which leads to death. So it control the viral replication load and opportunistic infection. And if they use this to reduce viral load, and this is used in combination which consists of 3 drugs in which at least 2 of different classes are called triple cocktail. Also 3 or more drugs of which 1 or 2 are NRTI, that means nucleosidase nucleosidase reverse transcriptase inhibitor. The condition is that for the treatment purpose and the regimen of the AIDS control, in the treatment of the AIDS, the heart therapy includes the treatment in that it should be the 2 NRTI, that means nucleosidase reverse transcriptase inhibitor plus 1 protease inhibitor, or 1 nucleoside reverse transcriptase inhibitor plus 1 non-nucleoside reverse transcriptase inhibitor and 1 protease inhibitor. This should be maintained in the heart therapy. In the heart therapy, the drug used mostly NRTI. The side effect of that is mainly peripheral neuropathy, and in ocular side effect, the heart therapy, the uveitis is most common for the ocular side effect. The treatment of choice for extended beta-lactamase producing enterococci, the drug of choice is piperacillin plus tazobactam. In the new drug designing, the problem arises in increased drug interaction with the non-target protein. Next is unfavorable interaction of the drug and substrate in the human beings are all. Here asking about the exception is the barbiturates decrease B12 absorption. Next is true statement is dobutamine decrease peripheral vascular resistance. Next is true about anti-epileptics are phenytoin and carbamazepine acts by prolonging sodium channel activation. Carbamazepine also used in trigeminal neuralgia. Actually, carbamazepine is the drug of choice for the trigeminal neuralgia. and a diazepam is an anti-epileptic drug. Next is, which of the following is antipsychotic available in a depot injection? Is flufenazine and also aripiprazole, haloperidol, juclopenthiazole, paliperidone, olanzapine, risperidone. These are the antipsychotic drug which are used in depot injection. True about first order kinetics is the rate of elimination is proportional to plasma concentration and power is the order of the reaction. If zero order, that means rate of elimination. Here the rate of elimination is proportional to concentration to the power order. If zero order, that means rate of elimination independent of concentration. If order is first, then rate of elimination is proportional to concentration, and order is 2, that means a square of the concentration. Next is the drug induced colitis is most frequently associated with clindamycin. Next is a female patient under treatment for the depression took a massive dose amitriptyline for suicide. The true about management is the amitriptyline dose. The gastric lavage was done. Sodium bicarbonate was administered to treat acidosis and diazepam was injected to control seizure. Next is drug used to treat hormone responsive breast cancer. It is tamoxifen. Many times repeated question. The drug banned for the player by the International Olympic Committee are. These are salbutamol. If you divide it, then in that includes androgen, blood doping, erythropoiesis stimulating agent, peptide hormone, diuretics, beta-2 agonist, narcotics, cannabinoids. The androgen includes anabolic steroids and testosterone. Blood doping includes the blood transfusion and erythropoiesis stimulating agent that aggravate the blood production. It is used for the athletes, so it is banned. And the peptide hormone includes ethyl estradiol, danazol, estrogen, tamoxifen, and the diuretics includes desmopressin, spironolactone, acetazolamide, and the stimulants includes amphetamines, ephedrine, pseudoephedrine, adrenaline, etc. And the beta-2 agonist includes the drug salbutamol, salmeterol, bambuterol, etc. It is due to for bronchodilation. That's why such drugs are banned. Next is the traditional medicine effective in the treatment of the heart failure is the Terminalia arjuna. It is used in the traditional medicine. The amifostine is a radioprotector. Next is the bremelanotide is used for erectile dysfunction. The bremelanotide used for erectile dysfunction in the male and female sexual dysfunction. It is non-selective melanocortin receptor agonist, which are non-selective, and some drug is the setmelanotide, efamelanotide, modimelanotide. These are the melanocortin receptor agonist. Next is most recent oral DTI used for prevention of acute stroke is the dabigatran. The lead retraction is the site of apraclonidine. The brinzolamide is the highly specific, reversible, and non-competitive carbonic anhydrase inhibitor. The ozurdex is a dexamethasone. The peripheral conversion of T3 to T4 is inhibited by the drug amiodarone, propylthiouracil, and propranolol. Next is true about octreotide. Octreotide is octapeptide that mimics to somatostatin, and these are potent inhibitor of growth hormone, gastrin release, CCK release, VIP release, glucagon release, insulin release, TSH release. So octreotide are inhibitor of release of the such condition. So used in gastric growth hormone producing tumor like acromegaly, gigantism, osteophageal varices, radiolabeling in the PET, positron emission tomography, and due to overproduction gastrin and CCK, so used in the condition the secretory diarrhea control. Next is the drug used for treatment of multiple sclerosis is the interferon beta. In the multiple sclerosis, the relapsing remitting multiple sclerosis, the treatment will be interferon alpha 1A, interferon beta 2B, and glatiramer acetate. Next one is the only drug found to be beneficial in halting the progress on EDSS, expanded disability status score, is natalizumab. Next one is the drug used as a transcranial patch for the treatment of Parkinson's disease is rotigotine, and factor predisposing to chloroquine toxicity is the cumulative dose should be more than 460 gram, daily dose more than 250 milligram per day or 3 milligram per kg, and renal failure. These are conditions for chloroquine toxicity. Next one is the efavirenz Efavirenz is a non-nucleoside reverse transcriptase inhibitor. So used in HIV first reverse transcriptase inhibition. True about pioglitazone. The pioglitazone is metabolized in liver and not given in case of diastolic dysfunction and PPAR gamma agonist. Next is a patient on insulin and acarbose develop hypoglycemia. For the treatment to be given here should be the glucose. Next one, the hypoglycemia caused by insulin, glimepiride, netiglenide, antidiabetic drug with IDE cause hypoglycemia. The true about exenatide, it decreases glucose secretion and it is a GLP analog and it given subcutaneously. Methotrexate is used in psoriasis, rheumatoid arthritis, ankylosing spondylitis. Next one is the indication of cotrimoxazole are. The cotrimoxazole used in typhoid fever, prostatitis and lower urinary tract infection. Ifosfamide, it is a drug. This is drug used in many carcinoma. It is nitrogen mustard metabolized by CYP3A4 to form active metabolite and chloroacetaldehyde is active form. The angina worsened by sumatriptan, dipyridamole and thyroxine. This condition aggravate the condition of angina, so it is worsen. Megaloblastic anemia caused by phenytoin, sulfasalazine, alcohol, methotrexate, all others. Octreotide is used in insulinoma, glucagonoma and carcinoids, already told previously. Next is the true about diazoxide. The diazoxide is a potassium channel opener, so can be used as the antihypertensive agent and used in insulinoma. Next one is the topical. Mitomycin C is used in treatment for the tracheal stenosis. Next one is bleomycin toxicity is characterized by destruction of type 1 pneumocyte. That means bleomycin destroy type 1 pneumocyte. While that next is regarding AC inhibitor, the true is omission of prior diuretic dose decrease the risk of postural hypotension. The adverse effect of tamoxifen used for breast cancer are the thromboembolism, endometrial carcinoma and the cataract. The side effect of naloxone are hypertension, pulmonary edema and the ventricular dysarrhythmia. The muscle's rigidity due to opioid is because of its effect on mu receptor. The drug used in sickle cell anemia is the hydroxyurea. This is pharmacology part second one-liner. Thanks for watching my video. Have a nice day.